Effective Preceptor Series. The Preceptor and Cultural Competence. What is cultural competence? According to the Association of American Medical Colleges, cultural and linguistic competence is a set of congruent behaviors, knowledge, attitudes, and policies that come together in cross-cultural situations. Culture refers to integrated patterns of human behavior that include language, thoughts, actions, customs, beliefs, and institutions of racial, ethnic, social, or religious groups. Competence implies having the capacity to function effectively as an individual or an organization within the context of cultural beliefs. The purpose of these educational standards is to ensure that the medical world is keeping up with the rapidly evolving demographics of the U.S. population. Cultural competence is not an option, but a necessity to maximize the patient-physician interaction and physician effectiveness as a member of the healthcare delivery team. What is the relevance to preceptors? Preceptors are positioned at the intersection of culture and clinical skills. Therefore, they must use cross-cultural skills that are vital to the practice of medicine and share them with medical students. What should the preceptor assess? To assess a medical student's knowledge, skills, and attitudes in cross-cultural education, the following examples have been recommended by the AAMC. Knowledge assessment. Has the student learned the key core cross-cultural issues, such as communication styles, mistrust, prejudice, autonomy, and family decision-making? Skills assessment. Has the student learned how to explore core cross-cultural issues and the patient's explanatory model of health? Has the student learned how to effectively collaborate with a patient? Attitude assessment. Has the student learned the importance of intellectual curiosity, empathy, and respect in cross-cultural encounters? What cross-cultural communication models are available? One of the most comprehensive approaches to facilitate cross-cultural communication uses Kleiman's questions. For example, what do you think has caused your problem? How severe is your sickness? What kind of treatment do you think you should receive? What are the most important results you hope to receive from this treatment? What do you fear most about your sickness? Other approaches use the belief or ethnic mnemonic. Let's go through both of these. Belief. Beliefs about health. Explanation. Learn. Impact. Empathy. And feelings. Ethnic. Explanation. Treatment. Healers. Negotiate. Intervention. Collaboration. Teaching students to work with interpreters is also very important. Here are a few guidelines outlined by the Provider's Guide to Quality and Culture. Do not depend on children or other relatives and friends. Hold a brief pre-interview meeting with the interpreter. Avoid jargon and technical terms. Keep your utterances short, pausing to permit interpretation. Ask only one question at a time. And be prepared to repeat yourself in different words if your message is not understood. If you absolutely must communicate through someone who is not a professional, make sure the family member or friend understands his or her own role before you begin. Use simple vocabulary. Speak in short sentences. And check to see that the message is understood. For a comprehensive list, please visit the online website for the Provider's Guide to Quality and Culture. Medical students need to know and remember that medicine itself is a culture. That means that we bring at least 2 cultures to a patient encounter. As preceptors, it is critical that we role model our cultural competence and deliver quality health services.